Well, the main thing you have to know about COVID-19 for people with spinal cord injury is that they have a high risk for upper respiratory infections, particularly patients with high level of injuries, most likely we call tetraplegia, which is neck injuries down, which is the most common injury. They do have issues with respiratory management of their secretion. So when they have these type of conditions like COVID, which affect upper respiratory tracts, they will likely have problems breathing. And it doesn't happen in all cases, but it can be very significant for certain populations. So it is important for patients to recognize the signs and symptoms of COVID or any upper respiratory infection so that they can act sooner and then prevent complications. COVID-19 vaccines are safe for patients with spinal cord injury, yes. The reason why is because they've been tested, we've been using it for a while now, and obviously these medications or these vaccines can have side effects and we have to be aware of it. But for the most part, it's called risk-benefit. These patients need the vaccines. The number one cause of death in these patients is pneumonia. So if they have COVID-19 upper respiratory infection and turn out to become a pneumonia, the chances of going to the hospital, being in a ventilator and dying, it could be prevented if they get the vaccine before all this happened. No patient should start the medication before receiving a vaccine for COVID-19. And the reason why is before they do that or any type of concern, they need to consult the primary care doctors or their spinal cord injury provider like me. The reason why is important to understand that some medications are essential for them to prevent other complications like spasticity, blood pressure issues, and things like that, or bladder issues or bowel issues. So before they do that, if they are concerned, they need to contact us or primary care provider to figure out if there's any interactions with the vaccine or there's any issues they are concerned, but they should not stop the medication before talking to us. Follow regular hygiene guidelines, wash your hands, and if you are in an environment where you need to wear a mask, then you need to wear a mask. Isolation, if they think they are sick with the COVID-19, don't touch on their faces, things like that, washing their hands constantly. Those are the things mainly that everybody does to prevent upper respiratory infections. Get vaccinated too. If they feel that it's still happening, they have the test, but they feeling well, the first thing they need to do is contact the primary care doctor or consult our clinic. The reason why is because they might need to be tested again, but they might need to be tested for other respiratory infections. And so that if that's the case, the first step is to get isolated for prevention to spread the disease while the test is done. So the main thing is to be aware of the symptoms of the COVID-19 or any upper respiratory infection, which is, some of them are very similar. They need to be aware that they are high risk. People who have cancer, people who have other conditions, underlying conditions, diabetes, things like that, they need to be aware of it. Particularly spinal cord injury, people who have other comorbidities along with spinal cord injury need to be aware that maybe that led to decreased response of the immune system to fight the infection. And that is a problem because that may make them sicker and they have to go back to the hospital again. The main symptoms for COVID-19 infections are going to be upper respiratory. Some of them also are GI, but fever, cough, sore throat, fatigue is a big one. Diarrhea is another one. So those are the things they have to pay attention to. Fever is a big one, particularly. But any type of upper respiratory symptom, coughing, productive cough, those are the things they need to be aware of it. The main thing for our patients is they need to understand that because of the significance of the injury, the risk of upper respiratory infection in our patients is huge, is high. So they have to be aware that if they are at risk of COVID-19, if they feel sick, they need to be isolated. They need to contact the primary care doctor and make sure that as the symptoms progress, they need to monitor all of them and figure out if they need to go to the doctor or not. Because sometimes the primary care will say, stay at home, don't come here because you won't have to spread it. But with our patients, it's different because they will have a little more complicated presentation, shortness of breath. This is all to say that if you have increased shortness of breath, fevers, cough, they need to go right away to the primary care or emergency room.